cartilage repair technique. So how MIS is changing the game and how it is making everything very smoother and very, you can say, foresight for the orthopedic things.
Right. So orthopedics, when it started, it was mainly done to treat a problem which is already there. So it was more curative. Nowadays, the world is moving towards preventive medicine.
Preventive medicine.
Preventive medicine.
What is it?
That means you are trying to solve the problem even before it is occurring, or you are trying to regenerate or get back the normal anatomy which God has given you. So we are not waiting for the joint, for example, to get damaged fully and do a knee replacement. If we catch the problem early, we have a lot of techniques which you said, like cartilage regeneration, regenerative medicine, which we can do. We have a lot of therapies, like we can do some injections. We have stem cell therapy. We can do arthroscopy, cartilage regeneration. If we catch the patients early, we can roll back the damaged cartilage and we can get the native cartilage. So we can prevent the osteoarthritis from happening, and hence we can delay or maybe forgo the joint replacement surgery if the patient comes to us and